Okay, so the poem is Tulips by Sylvia Plath. So before we begin, Tulips, something about Sylvia Plath, which many of us may be familiar with, right? She died quite young by suicide at the age of 30. And before the final attempt, the final successful attempt, before that also, she had tried a couple of times to commit suicide, but then she came back to life. For instance, the poem Lady Lazarus. There she speaks about her attempted suicide and coming back to life. So she compares herself to Lazarus who has come back to life. So she calls herself Lady Lazarus. So this preoccupation with death is a constant factor in almost all her works. And her novel Beljar talks about her experience with depression. That's the only novel published. And then you have a collection of poems called Ariel, which became very, very famous and popular. And this poem is taken from there. We know that she was this very brilliant student with a Jewish background. Um, Born and brought up in America, she went to Smith College, that is in Boston, and later she went to Cambridge, and it's in Cambridge that she met Ted Hughes. They got married, and after that, we know how there were problems in their marriage. She was driven to despair. She was already into depression, and then the marital troubles added to her agony. And finally, she took her own life one day, and that is after feeding her children, keeping milk, everything ready. She gassed herself. That is, she switched on the gas and then she inhaled that. So she gassed herself to death because so difficult was life for her. It's only people who are very sensitive and depressed, they understand what the what it is to be depressed and what the feeling is like. People like us who are standing outside the frame, we can only judge or say like how could she do that, especially leaving two young children behind. But then when you try to put yourself in her shoes, maybe that may have been the best way out. We don't know. And these poems, most of her works, they all cry out that despair, that pain, that anguish and agony. It talks about days, it talks about experiences wherein you feel you have hit rock bottom. You have really entered a dark tunnel from which there is no return. It's actually a state of mind. For her, it was psychological and also the situations in her life. She had these conflicts with her parents. Her father died when she was quite young, and then she was feeling very guilty about it. She was very attached to her father. Her father was very dominating. So she had these unresolved issues with her parents. And then later, marriage also turned out to be a crown of thorns. So there was no succor anywhere in any of her relationships, and she herself was a victim of depression. So all these things can be seen in her work. Now, Tulips, it was written sometime before her death, and the occasion is her hospitalization. She was hospitalized for a minor surgery, that is for appendicitis. So appendectomy, and that's the operation. You have to have your appendix removed. So she had this problem and she was admitted for surgery. So her experience in the hospital makes her reflect about death, the whole hospital setup, the white and sterile background. It makes her reflect on death. And then there's the sense of peace. We know hospitals can be very quiet and very, very peaceful in a very eerie sense, wherein it's very strange, and then you might even feel kind of scared of that stillness. So into that peace and calm and whiteness, someone sends her a bouquet of tulip flowers, tulips that are red in color, bright red, blood-like tulip flowers. So these flowers arrive and these flowers are kept in the room. So now she looks at these flowers. The redness of the flowers is in contrast to the white sterility of the hospital room. So these two things are constantly looked at and then compared. So tulip stands for blood, red color. Blood, it stands for life. It stands for open wound, all things that are painful also. So there is a comparison and a contrast between the sterility and whiteness of death and the hospital compared to that of the rawness, you could say the throbbing, bloody picture of life as represented by tulips. Fine. So let's get started. You can just have a look at Sylvia Plath, the picture of her, the very dynamic, admired poets of the 20th century. So even before her death itself, she had tasted success. So she committed suicide at the peak of her career. That shows that she didn't care much about adulation or fame. The pain was too much for her compared to anything else. So here we go. Tulips by Sylvia Plath. So the whole background, everything has been given. All right. So now she's talking about the tulips. The tulips are too excitable. It's winter here. Look how white everything is, how quiet, how snowed in. I'm learning peacefulness, lying by myself quietly as the light lies on these white walls, this bed, these hands. I'm nobody. I've nothing to do with explosions. I've given my name and my day clothes up to the nurses and my history to the anesthetist and my body to surgeons. So this is the picture of total surrender, wherein she has become a nobody. And what is the occasion? Admission into a hospital for surgery. So when you are in a hospital, you give up your clothes, right? You're required to remove your clothes and you're supposed to wear the hospital gown. And you become a number, a history sheet to the hospital, nurses, and doctors. All your individuality, your education, your persona, all these things are thrown out of the window. You just become a body to be examined and studied. We are just reduced to our physiognomy in a hospital, right? So that is the situation. So she's talking about tulips in the beginning. We know why is she talking about tulips? Because these tulips have arrived. Somebody had come to visit her and they've given her this bunch of tulips. So tulips look very exciting because it's very deep, bright red in color and it is winter. So look at the background and everything is white and everything is very quiet and it's snowing outside. So it's winter time and there's snow even outside. And then she's lying inside the hospital and she's learning peacefulness. There is quiet, there is peace everywhere. She's lying by myself quietly. That is, she's all alone. She's lying there quietly. And there's a light on the white walls. The walls are white. The bed, the hands, everything is kind of white and pale, and there is light. In winter, even outside, when you have snow during the daytime, when the sunlight falls on it, it gets reflected. So it becomes all the more whitish, wherein your eyes also get hurt. It's that kind of bright white. So that's the background. Whiteness everywhere, all white, 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 and pale. Who am I? I am nobody. I have nothing to do with explosions. We don't know in what context she's speaking about explosions. Maybe she's speaking about things happening outside. So she's saying, I'm nobody. I cannot do anything. All my individuality, all my labels, all my achievements, these things don't matter. What has happened to her? I've given my name and my day clothes up to the nurses. That is, once you get admitted to the hospital, your name is given to them and you just become a number, patient number, inpatient number, whatever. And your clothes also are also taken up by the nurses. You're supposed to wear the hospital gown. And my history to the anesthetist, that is history as in her medical history, whatever she is, that has been told to the anesthetist. And now her body belongs to the surgeons because she has had the operation or going to have the operation. So let's assume she's had the operation. So the body now belongs to the surgeons. So this is that ultimate surrender, being nobody. I have no name, I become a number. I have no clothes, I have only that hospital cloth and my history. Whatever I know, everything has been handed over to the anesthetist and my body, it belongs to the surgeons. They have propped up my head between the pillow and the sheet cuff, like an eye between two eyelids that will not shut. Stupid people, it has to take everything in. The nurses pass and pass. They're no trouble. They pass The way gulls pass inland in their white caps, doing things with their hands, one just same as other. So it's impossible to tell how many there are. So now she's lying on the bed. So they have propped my head between the pillow and the sheet cuff. Sheet cuff is that edge of the bed sheet. So neatly, uh, you could say covered bed sheet, and then one side you have the pillow. So between the pillow and the bed sheet, her head is popping out. So she's covered by the bed sheet. Her head is outside, and it is resting on the pillow. So the pillow is white, the bed sheet is white, and her head is now jutting out. So head is maybe darker compared to the bed sheet. So the whole picture looks like an eye between two white lids that will not shut. See the comparison. Try and imagine. So on one hand you have the pillow, and the other hand you have the neatly tucked in bed sheet. And in between these two, what is there? Her head is jutting out. So the whole picture it looks like an eye, as in the pillow and the bed sheet. They are like eyelids, and in between you have the eye that is head of Sylvia Plath. So these eyelids they don't shut. A pillow and the bed sheet they don't shut, and her head is appearing like an eye. And now she's speaking about her own eye. Stupid pupil, that is stupid eye. Why is it stupid? Because it has to take everything in. That is, whatever is around, by default, we end up looking at it. So, stupid pupil, it has to see everything that is around. So, what is around? The nurses pass and pass. They are no trouble. So, these nurses, they come and go. Nurses, they come and go, but they're not creating any trouble. That's okay. I'm okay with them. They pass the way gulls pass inland in their white caps, doing things with their hands, one just the same as the other. So all these nurses are compared to seagulls. Seagulls, white birds. So these birds, what do? They come from the water. They come to the inland area from the water. They come, they go. There will be many of these birds coming and going. So just like that, these nurses dressed in white, they look like these birds coming and going, and they are wearing white caps. So because of their white dresses, white cap, white socks and shoes, everything, they are looking like girls, and girls coming and going. They're doing things with their hands, these nurses. And one just the same as the other. They all look the same. All the nurses, they all are looking the same. I cannot distinguish one from the other. That's what she's saying. So it's impossible to tell how many there are. So I cannot tell how many nurses are around because they all look the same. They come and go. They all are in white and they look like seagulls. So it's a funny imagery. So the whole place is white and sterile, and adding to the whiteness and sterility, you have these nurses who quietly come and go, all dressed in white, and they look like seagulls. And you cannot tell one from the other because they all look so similar. Now, my body is a pebble to them. They tend it as water tends to the pebbles it must run over, smoothing them gently. They bring me numbness in their bright needles. They bring me sleep. Now I've lost myself. I'm sick of baggage. My patent leather overnight case like a black pillbox. My husband and child smiling out of the family photo. Their smiles catch onto my skin, little smiling hooks. Now, what has happened to her body? Her body feels like a smooth, gentle stone, a small pebble. So my body is like a pebble, and they bathe the body. That is, when you're admitted in the hospital, when you're bedridden, obviously they will bathe you. They'll give you that sponge bath. So they're tending it. They're taking care of my body, and it's compared to a pebble over which water runs. Pebbles, they become that smooth and round and soft because of water that flows over it. You must have seen plenty of pebbles wherever there is a water source, waterfalls, rivers, you'll find plenty of pebbles. So they are doing it very gently. They are taking care, bathing my body just like pebbles are bathed by water. They bring me numbness in their bright needles. They bring me sleep. So these nurses, what are they doing? They make me feel numb in order to make her feel no pain. They are using needles to give her injection. So painkiller injections are given, and because of which she feels numb, she can't feel anything, and then it puts her to sleep. So some kind of medicine that numbs the pain and makes us sleep. Now I've lost myself. I'm sick of baggage. So now we've already seen she's lost herself. Now she's even going into sleep. That sleep, in the sleep, she's losing herself. I'm sick of baggage. That is, I'm fed up of all the baggage that we associate with life. So the baggage that she's speaking about in these lines, they refer to the material possessions that she has. It can also mean that she's sick of the baggage that her body is. Our body is our ultimate baggage, right? We carry it around wherever we go. So I'm sick of baggage. So this can mean many things. Being sick of baggage, maybe her worldly positions, maybe her own body. So there's this desire to lose herself and to feel weightless. She doesn't want to carry anything with her. That's why she's saying, I'm sick of baggage. And my patent leather overnight case, like a black pillbox. So she has come to the hospital with an overnight case. Overnight case, as in a small bag that you carry when you travel to some place for a day or two. You know, maybe you can pack in just one or two pairs of dress and maybe a toothbrush and brush and things like that. So her patent leather overnight case is it's staying there in the room. You know, it's kept on the table or somewhere. It's looking like a black pill box. And then what else is there? My husband and child smiling out of the family photo. So on the table there's a small family photo in which her husband and child, they are smiling back at her. So you have Ted Hughes and a kid. So there's one photo there. Their smiles catch on to my skin, little smiling hooks. So they're smiling in the photograph and she's looking at them. And what does she feel? The smiles are catching on to my skin, little smiling hooks. Now, hooks. Why is she talking about hooks, about smile? What do you use hooks for? You use hooks to hang things. When you want to hang something onto something, you make use of hooks to support. So, on one hand, she has this desire to lose herself, to be liberated from all these things. But on the other hand, and she is being latched onto by the hooks that are the smile of her husband and child. So, on one hand, you have the desire for deliverance, and the other hand, you have these people smiling at her, making her kind of stay back. Maybe that, see, when we think about dying or when we think about running away, we usually think about people who may be the most affected by that. And that very thought is like a hook which would help us or which would make us stay back or hang on. So maybe it's a reference to that kind of a feeling. So on one hand, you have the desire for liberation, and on the other hand, you have the smiles of her loved ones holding her back from this desire to be relieved, to go away from there. Okay, we'll do one more stanza and we stop for the day. I have let things slip. A 30-year-old cargo boat stubbornly hanging on to my name and address. They have swept me clear of my loving associations. Scared and bare on the green plastic pillow trolley, I wash my tea set. My bureaus of linen, my books sink out of sight, and the water went over my head. I'm a nun now. I've never been so pure. So now she's saying, I've let things slip. That is, I have let things kind of go away from me. That is, I am becoming detached. I don't want any material possession. I don't have any affection. I don't have any attachment for them. And what am I? A 30-year-old cargo boat. 30-year-old cargo boat. That is her body. She is like a cargo boat. And what is a cargo boat? A boat loaded with goods. So my body is loaded with all kinds of experiences, memories, all kinds of pain, things that are weighing her down. So my body, that is I myself, I'm a 30-year-old cargo boat stubbornly hanging on to my name and address. So I'm that body is still hanging on. That body still has my name and my address. That is who I am, whatever. But then in her mind is the one looking for liberation, but her body is pulling her down. It's like stubborn. It's very stubborn. It's not letting go. That is, her, her body is not letting go of the soul. That is, I am not yet dead. So that death wish is coming across in almost each of these stanzas. So I have let things slip. That at the mental plane, I become that. I'm not attached to anything, but my body, my 30-year-old cargo boat, is still stubbornly hanging on. It's hanging on to my name and address. That is, I'm still alive. And now, what has happened to her in the hospital? They have swept me clear of my loving associations. So, in the hospital, they swab you very clean using all Dettol and antiseptics. So you become really, um, what is that process known as, wherein all the germs and things are killed? It's a very familiar term these days. What is it called? Swabbing and cleaning.
Sanitize.
Yes, sanitizing. So sanitizing has been done. So they have swept me very clear of my loving association. So this is also working on two levels. So on the mental plane, she has let go of all the attachments and all the the things that hold her back. And in the physical plane also, she's become very sanitized. All the loving associations, that anybody who has touched her, whatever, when we touch each other and all, obviously we pass that germs, that is bacteria. We all have bacteria living on our skin, right? So so when once you get sanitized, what would happen to you? Everything would be swabbed clear. So she has been swabbed clean and clear of her loving associations. Now she's feeling kind of scared and bare on the green plastic pillow trolley. I watched my tea set. So maybe she's referring to how she was wheeled away from her personal possession. So she was feeling a bit scared, because once you are on that stretcher and you're being taken away to your bed or to the operation theater, if you have experienced it, you would know it's a scary situation. Even if you want to die, whatever, you do feel scared, because you are at the mercy of these doctors and nurses. There's nothing you can do there, right? So she's feeling very scared and bare as in she's been stripped of everything, and she's lying on that green plastic pillowed trolley, and she's watching her tea set, my bureaus of linen, my books sink out of sight. So maybe this was how she was wheeled out of her home. An appendix operation may be warranted because of a ruptured appendix. We don't know. So if you have a sudden rupture, you may have terrible pain. Some people even die of that. So maybe in that situation, she was wheeled out of her home and taken to the hospital. So when she was being taken out of the home, she was watching her belongings, that is her tea set, her bureaus of linen as in cotton clothes, the books on the shelves, all these things she was looking at, and then they sank out of sight. That is, when she was being wheeled out, these things went out of sight, and the water went over my head. So we don't know what water she's talking about. Maybe somebody put some water on her head. We don't know. And it's again water going over my head, a comparison, or you could say a reference to the Christian ritual of baptism. So when she was wheeled out, water was poured over her head, and it's kind of a ritual, comparison to a ritual of baptism. So now, what is she saying now? After all this, after shunning, after giving away, after getting away from all her personal belongings, and then being washed clean and swabbed and sanitized, what am I? I am a nun now. I become like a nun. And who is a nun? Someone who has renounced the world, someone who does not have anything to do with the world, any relationship with outsiders, someone who has given up everything. Nuns even give up their name. They take on new names once they join the convent, right? So I'm a nun now. I've never been so pure. So I feel so pure because I've been dissociated with all my attachments, all my relations, all my belongings. So I'm kind of simple and pure like a nun, with no attachments, no affections, no relations, and no hanging on to anything. So it's that ultimate liberation. So at the on the mental plane as well as at the physical plane, that plane, that is that ultimate liberation from all kinds of threads and pegs that pull you down into your everyday life.